Ladies and gentlemen, dear participants, welcome back for our second plenary session, Tackling Korea's Mental Health and Demographic Crises, the Korean Miracle 2.0. We're excited to feature the plenary session between the 12th president of the World Bank Group, Jim Young Kim, and assistant professor in the Department of Psychiatry at the Yale School of Medicine, Peter Jong-ho Na. They will probably discuss one of the most debated health topics in Korea. They will define potential common roots of the low birth crisis, mental health, and suicide crisis in Korea. Also, the session will address the current state of mental health in younger Koreans and discuss pathways to combat these three public health crises in Korea. Let's welcome the speakers with a round of applause, please.
Thank you, ladies and gentlemen, for joining us today. It is my great honor to be with you with the GEF 2024. I'm usually a person with high self-esteem, so I usually don't compare myself to others, but I've never had more imposter syndrome than I had right now to be with Jim here. Some of you may know me, some of you may not. So I'm a psychiatrist. We're primarily based in the US. I work for the VA Connecticut system, healthcare system, and as an assistant professor at Yale. And what I've been trying to, so the reason I just want to briefly talk about my commitment to this issue. So I was a psychology major, and I went to med school with the hopes that we could prevent suicide, and I could be at the forefront of that. And I moved to the US. I published a book, which gave me some fame and gave me some voice to tackle this issue. And after I published my book, it was about a year after, I thought of what I would like to do for the rest of my career. So I was just starting my career, and I started this daunting task. I wanted to mitigate suicide, and that was kind of the goal of my life. But how do I do this? I mean, I'm working 99% in the U.S., and I have this small fame in South Korea, so I'll just keep on writing. And then I got an email from Jim, who coincidentally was having the same concerns about mental health and the suicide problem in South Korea. So since then, I've been working alongside with Jim, Dr. Kim, and have been trying to tackle this issue and trying to create a social movement. So today we're going to talk about that. We'll discuss broad topics about loneliness, about mental health, about suicide, some difficult conversations, but we think it's an existential threat to the nation. So I'd like to introduce you to the renowned Dr. Jim Kim.
Thank you, Peter. First of all, let me just say thank you for everyone who's here. And I want to start off by talking a little bit about our dear 사무총장님 Ban Ki-moon. So Secretary General Ban Ki-moon, I've known him for a long time, but I was elected to be president of the World Bank in April of 2012. And the Secretary General was one of the first people to call me. And he called me, and he was just so excited. He was so happy. We'd known each other. And then during the time that we were there together, which was, I think, about 5 years that we overlapped, we did more things together, the World Bank and the UN, than ever before in history. And when we took our first trip together to Africa, I arrived and went to meet him. And he said to me, he said, we looked at the history books, and this is the first time in history that the President of the World Bank and the Secretary General of the UN have ever traveled together to countries. Now, you'd think that it would make perfect sense for them to do that. We're part of the multilateral system. We try to do many of the same things. But it was so easy because I called him 선배님. right? He was my sunbae. And every time I call, when I referred to him as sunbae, he would stop the conversation and he would explain to everybody what sunbae means. And so it was one of the easiest relationships, but he brought me in a way that was just so far above and beyond what anyone could expect. And I think over time, history will look very, very kindly on the time that he spent at the United Nations. The climate agreement would not have happened without him. The SDGs, the Sustainable Development Goals, dramatically expanded the kind of goal setting that there was in the UN. The first set of goals were mostly about health. What he did was just stunning, and which is why I'm so honored to be here at the conference that is really being put together by his foundation. So I just want all the Koreans in the audience to know that in Secretary General Ban Ki-moon, we have a treasure, a national treasure. What he did as a Korean to help the entire world was just absolutely historic. I don't think he's here, but if we can just give him a round of applause. Now, it's great for me to be here with Peter. And, Peter is, from my perspective, a relatively young, very accomplished psychiatrist. And I have learned so much from him. And Dr. Baek Jong-woo, where is Dr. Baek? He's in the audience somewhere. Please stand up. Dr. Baek is one of the absolute heroes in Korea, treating people who, as a psychiatrist, but also very active in suicide prevention. He's another one of my teachers. He's here. Thank you for coming, Dr. Baek. Yeah. So some of this work was spurred by conversations with President Yoon, but also just conversations with friends in Korea. This fact about suicide rates in Korea came up many years ago for me when I was still at the World Bank Group. I was having a conversation with Christine Lagarde, who was the managing director of the International Monetary Fund. We did a lot of events together. We did a lot of panels together. And we were talking about education and the stresses that people feel because of educational systems. And I said something to her. I said to her, Christine, children in Korea, starting from middle school maybe, go to school from 7 to 11 every day, right? And she said to me, well, that's amazing because Korean students do so well on standardized testing. How do they do so well on standardized testing going to school for just 4 hours a day? Right? And so I explained to her, no, it's not. It's 7 a.m. to 11 p.m. And the reason that the classes taken in the evening stop at 11 p.m. is because it's illegal to have classes past 11. So Christine got very interested in Korea. And then when she came here in 2019, as she always does, she looked at the data going on in Korea. And she said something that really shook me up. I was grateful to her for spending the time to learn about it. But she said, Korea is moving in the direction of becoming a collective suicide society, right? Christine is not a person to overstate and overblow things at all. She is extremely cautious. But the numbers are very daunting. And so let me just go over the numbers that I'm seeing. First of all, let me just say, I left this country when I was 5 years old. If I tried to do this lecture in Korean, you would all think that I'm a complete Byeongshin. I don't speak Korean well. So this is not my reality. And I don't want to pretend to be able to present to you your reality. I am just trying to look at the objective data that exists in the world. So what are the data that worry me the most? So first of all, Korea has had the highest suicide rate, except for a couple of years where Lithuania was a little bit higher. The highest suicide rate among OECD countries for 20 years. In 2013, OECD wrote a report on what Korea could do to try to lower the suicide rate because it had been 10 years already that Korea was in the lead. Right? That's the first and arguably the most jarring piece of data, right? The other, the kinds of data that now I'm become much more aware of. According to OECD studies, the estimated percentage of the adult population in Korea that suffer from depression is the highest in all OECD countries, 37% estimated rates of depression. At the same time, the number of antidepressive medicines, the amount of antidepressive medicines per person sold. This is not about people taking the medicines. It's about the number of pills sold for depression per person in Korea is the lowest in OECD. So 37% estimated depression rates and 2 or 3% of the adult population getting antidepressive medications. So there's a huge epidemic, if you will, of people who are depressed who are not getting treated. And again, you guys know the reasons for this much better than I do, but this is a really, really serious concern. So you have suicide, you have depression. Loneliness. So one of my former students and friend is the Surgeon General of the United States, Vivek Murthy. And I heard him, he's been talking a lot about loneliness. And I heard him talk recently, and he said something that really surprised me. He said that if you answer yes, that you are lonely on a survey, your life expectancy is going to go down. In other words, you'll die, or premature death, at the same rate as someone who smokes 15 cigarettes a day. So being lonely is the equivalent of a 3/4 of a pack a day cigarette habit. And we all know that cigarettes, of course, reduce your life expectancy, right? Now, loneliness does lots of things. It has an effect on health. Also, it adds to the numbers who are depressed. 64% increased risk of clinical dementia. Right? So people who say they're lonely have a 60% plus risk of clinical dementia. And so high blood pressure, many, many things that it has an effect on. Another just piece of data. Again, please don't think that I'm trying to tell you what the experience here is like. I'm just giving you the data, right? Another piece of data. In 1970, the percentage of the population that was living in single-family households, in other words, living alone, was 0.6%. By 2015, it had gone up to, excuse me, let me get that number for you. It had gone up to 25%, and then by 2022, 34%. So more than a third of all Korean people are living in single-family households. Right? At the same time, the level of poverty among senior citizens is among the highest rates of poverty in all OECD countries, 40 to 50%, depending on what numbers you look at. Right? So the loneliness epidemic. And then, low birth rate is very tough. And again, the low birth rate is related to very complex issues. And we're two men up here talking about this, and we're not, at all, trying to talk about women's experience of giving birth or getting married or any of those things. But the current total fertility rate, that's the number of children that a woman is going to have in her lifetime, right? So I think total fertility rate's the best way to look at it because it's very simple. You can understand it. So for every woman in a society, in order to replace the society, just keep the numbers the same, every woman in a society has to have 2.1 children during during the time of her life when she can have a baby, right? So 2.1 is just replacement because one man, woman, 2 children. Korea's rate is the lowest recorded in human history. Now, it might have been lower at some time, during the Neanderthals or something when there was a disaster. But since we started recording the numbers, right? So the official number, I think this year, Peter, is 0.7%.
It's 0.72, I believe. Last year for
0.72.
last year.
Right, 0.72. So it's about a third of the rate that would be required just to replace the society. So in 1991, and we're using these numbers in our group just so we can remember. In 1991, the great footballer Son Heung-min was born. And in that year, there were about 730,000 children born. Last year, there were a little over 200,000, right? So all the complex issues of gender inequality, of difficulty between, getting housing, these are all very complicated issues. But from an economic standpoint, looking at it and putting my World Bank hat on, right? It is impossible to go from 700,000 to 200,000 with incredibly high rates of poverty among the elderly, and think that the National Pension Service, NPS in Korea, is going to be able to support those people. There are going to be fewer and fewer working age people to support the elderly, right? So the loneliness epidemic, the depression epidemic, the suicide issue with the highest rates in the world, and then low birth rate at the same time, I think it's hard to come to any other conclusion than this is a fundamental demographic threat, an existential threat for the country. Now, I don't want you to think that I'm being an alarmist, and I especially don't want people here in Korea to think, well, why is he talking about those kinds of things? It's just, we don't want to talk about those things. Either they're shameful or something like that. But I'm talking about them because this is not a phenomenon that's limited to Korea. Let's take a look at China, right? The overall population in China declined for the first time since 1959. There was a period in 1959 to 61 that was a very tumultuous time in China. But the first time overall population decline was in 2022, and it happened again in 2023. And so the total fertility rate in China, of course, they had a one-child policy for so long. Gradually, they opened things up, and between 1991 and 2017, the overall fertility rate was around 1.7. But then it's gone down 1.28 in 2020, 1.08 in 2022, and 1 in 2023. There is a phenomenon in China, young people call it lying down, right? And they're talking about it specifically in saying that all of the intense work, that the intense competition to get into the best schools, things that sound, I think, very familiar to Koreans. There's a phenomenon that they call lying down. And it's young people who may go to work, but who don't really do much, and others who just opt out of the system altogether. Apparently, there are many, many young people who are going to Buddhist monasteries and going and just meditating and dropping out. Right? In the United States, after COVID, they called it quiet quitting. But the point is, these kinds of demographic shifts are happening all over. India, which had high birth rates for such a long time, for the first time last year, the total fertility rate for Indian women dropped below replacement level, right? So this is something that we just have to get our heads around. We have to talk about it. We have to think about the potential solutions. Peter, do you want to jump in? Go ahead.
Since our session is about the youth, I just wanted to share my perspective, and because Dr. Kim started with the comment from Christine Lagarde about the collective suicide society, which I think is a pretty strong term, but also is close to the data. So I've been looking into the data Dr. Kim was just describing. And what blew my mind was that, so when Christine Lagarde, supposedly she came in 2017, so supposedly she would have looked into the data of 2016, and the fertility rate since then has actually dropped by 40%. So I'm not sure what she's going to talk about when she looks at the data right now. But what threatens me the most is there is one statistic that just dramatically increased during the same period, and that is the suicide rate in younger adults in South Korea. So South Korea was always notorious for older adult suicide rate. So I use this analogy a lot, but the suicide rate in older adults who are in their 70s or 80s are comparable to the Jewish people who are under the Nazi regime. So we're thinking they are under a tremendous level of stress, socioeconomic stress. However, the good news among the bad news was that still the suicide rate of the younger generation was relatively low. And now, during the exact period when Christine Lagarde's birth rate from 2016 to 2023 dropped 40%, during that period, the suicide rate of the younger generation has increased, especially among people who are between 10 to 29. It rose over 40%. So after looking at that data, I came to ask myself, what are there common roots to these causes? So seemingly there is something going on in the younger generation, and there is a threat going on. So right now, the number one cause of death among individuals from 10 to 39 is suicide. And no other developed countries has that. It's mostly accidents in those countries. So after looking at that data, coming to the conclusion that there is a fundamental despair in the younger generation. I came to that conclusion, and there is data to support that. That's just not theory. So recently there was, a couple of months ago, there was a survey data published about individuals between 19 to 34, and what they found was that over 50% of younger adults define themselves as being depressed, and 1 in 3 younger adults in that age bracket thought about suicide. And as a psychiatrist doing mental health research, psychiatric epidemiology, that number only comes up among a population that has depression, right? So we're dealing with these numbers, and the reason Dr. Kim and I have been trying to send this alarm is that despite all this going on, I'm not sure if you mentioned this, but despite the highest prevalence of depression in South Korea among OECD countries, the prescription antidepressant rate was the lowest. So people are not asking for help. And the primary reason for that is stigma about mental illness, and that's what I've been trying to be an advocate for to mitigate that stigma. But not only that, what the recent data shows is that people don't even think about their mental health, right? So they asked a question, how much do you think about your mental health? And there were over 30 countries that participated in it. Brazil was number one. Over 70% reported that they think about mental health a lot or often. South Korea, it was less than 50%. It was the only nation that said they never think about mental well-being, and that number was below 50%. So we don't even think about these issues. So yeah, I mean, those are the data we're dealing with. Again, Dr. Kim and I have very different backgrounds. So I was born in the US. I came to South Korea when I was like 5 or 6. Dr. Kim, on the other hand, is completely opposite. So he was born in South Korea. He went back to when he was 5 years old. And as a Korean American who lived, so basically after coming back, I received all my education here. And I talked about this a lot, but while I was living here, I was thinking it was the competitiveness of the society was so immense. And many people ask me, why did you leave South Korea and why did you go to the US when you received all your education here? And I try to tell them that, I just couldn't stand the competition. So I do believe I do get the sense of the harshness of the Korean society and the education and everything. And I think it's time that we really talk about, back then, so I left South Korea about 10 years ago, And what I've been thinking was the society, to me, felt like a treadmill, right? So when we work out, we run on a treadmill, and it's not a treadmill where you control your pace. It's not like, I'm exhausted, I'll run a little bit slower. I felt it was a society that we go full power, the full speed you can run, and then it just goes on. And I felt back then, a decade ago, that I just couldn't do it anymore. I was off the treadmill. So I think this is a time that and recently there was, this Mark Manson, who's a YouTuber in the US, an American YouTuber who came to South Korea, and he said he visited the most depressed country in the world, and it was the media. It caught huge media attention, but I know I'm depressing everyone right now, but many media actually focus really much on what he said, like the negative things about South Korea, right? But I really wanted to focus on the last part. So after saying all the bad things, he mentioned South Korea has a unique resilience that other countries don't have, and South Korea will find a way. And he met lots of younger generation in the streets. And what he said was every younger generation mentioned that, acknowledged that this is a huge problem. And they wanted to give their opinion about it. They wanted to talk about it. So that's why he thought that there was hope. And I really want to focus on that. So it's not about giving you all the depressing facts or numbers, but it's about starting the conversation that, the lowest birth rate, the highest suicide rate for the past 25 years, we can't go on like this anymore. I've been more than, I think I benefited a lot from the huge success of South Korea over the past decade. I feel that the country is at the highest point, but at the same time, I really have to think about whether so I have to ask myself whether we're at the peak of our success or at the bottom of our despair. So I think it's time that not an American YouTuber, but we South Koreans have to think about it. And even Mark Manson said there, we really have to look deep inside ourselves to find the answer. And I think it starts from a conversation about mental health.
So so we're about halfway through. So I hope that we can then take you on a ride up and, really to think about what are some of the unique ways that Korea, which is living, with some of the most alarming data around these issues of all the countries in Asia. But as I said, all the other Asian countries are almost certainly going to follow this path as well. That why am I wildly optimistic that Korea is going to respond? Well, I need to give you some context, right? So I'm a physician. I also studied anthropology. I actually did my anthropology research here in Korea, and I'm actually a graduate of the Yonsei University 한국어 학당, right? I'm probably their worst student they ever had, but I'm a proud alumnus of Yonsei University. And so that was in the 1980s. But just if you look at my life course, I was born in 1959, which just must seem ancient for all of you. So born in 1959. And on the first day that I came to work as president of the World Bank, the vice president of the Asia region of the World Bank Group put a stack of papers on my desk. And on top of it, he wrote, funny how we get it so wrong sometimes. And the papers that he gave me were internal documents of the World Bank from around the time I was born, right? So in 1959, what the World Bank was saying about Korea was, one, very low level of literacy, relatively, about 40% of Koreans could read. The GDP per capita was lower than Somalia, lower than Ghana, right? Among the poorest countries in the world. Most of the industrial capacity was in the northern part, north of the 38th parallel. The northerners were much better educated. the South was mostly, the rural breadbasket part of Korea. And so in 1959, the official policy was that Korea was too poor to get a loan from the World Bank. And that's like almost no country is too poor to get a loan from the World Bank. And that was the funny part, how wrong we got it sometimes, right? And then the first loan came in 1963. That was around the time that we emigrated to the United States. And then in 1968, the second loan that Korea took was for education. And the people at the World Bank ridiculed Korea for doing something so stupid as to take a loan and invest in their education system. But we all know what happened. And so that was, 1960, 63, 64. I came back in 1984 to do my dissertation research. And I thought, Korea, still a developing country, maybe I can go back and help. Well, when I came here, Korea was preparing for the Olympics. And it became absolutely clear to me that there was nothing I could do to help Korea at the time, right? That there were so many wonderful professionals that I started looking elsewhere. And that is around the time, 1988, when I started an organization called Partners in Health. And Partners in Health has focused since 1988, since we founded it, on providing health care to the poorest people on earth. And we did it with a very clear ethical, moral perspective. We called it making a preferential option for the poor. And that commitment was that no matter where we were, even though we might have limited resources, we're going to give the best possible treatment to the poorest people because that's what they deserve. Right? And so over the course from 1988 till 1988 for the first 15 years of working at Partners in Health, we were just scrambling to try to provide as good a care as possible. We were raising money, but then we ran into a couple of epidemics. One was multi-drug resistant tuberculosis in Peru. The other, of course, eventually was HIV. And for both of those diseases, 99.999% of all the physicians in the world said it's impossible to treat those diseases in poor countries. And so we were saying, but why? Why is it impossible? Oh, the drugs are too expensive. Yeah, but what if you could lower the prices? Well, it's too complicated. Well, what if you gave technical assistance and taught them how to do it? Well, you shouldn't do it because there's not enough money in the healthcare world to pay for it, right? So instead of saying, oh, well, okay, we'll go away, we actually said, hey, what an opportunity. We're going to change global policy. We're going to change the world. So we started treating people with drug-resistant tuberculosis in Peru, and we started treating people with HIV in Haiti. And each time, we weren't, so when I went into doing these things, what I expected was people to say, we really admire you guys. I mean, it's great that you're trying to do this. And, we understand you have compassion for the poor. It's great that you're trying to do this. But, we just don't have enough money, and it's hard. It's hard to find the resources to treat these diseases also. That's what we thought we'd get. That's not what we got. People were angry at us. And they said, basically, who the hell do you think you are treating these people? If it were doable, we would have done it. What are you accusing us of? I mean, there was anger at us. And so to make a long story short, we won both of those fights, right? We changed policy for drug-resistant TB in 2003 at the World Health Organization after fighting with them, intensively for almost a decade, right? And then I ran the campaign of my good friend, Dr. Lee Jong-wook. I ran his campaign to become Director General of the World Health Organization, and he won. And so when he asked me to come, I said, on one condition, we're going to treat HIV, and we're going to get the whole world to treat HIV. My partner, Paul Farmer, that I started the organization with, took the before and after photos of our patients in Haiti to the White House, convinced the advisors to President George W. Bush that this was doable, and then President Bush announced that he was going to treat HIV. We won that fight too. right? And the sense that I want to give you is that both of those fights seemed far more impossible to tackle than the issues that you're facing here in Korea, right? I have enormous faith that Koreans can find solutions. I mean, during, I came on board at the World Bank in the midst of and in between various global financial crises. And some of you, the older people may remember when Greece had terrible financial issues. And I was just talking to different people, and someone in the World Bank said, "Hey, have you ever heard about the Korean gold collection experience?" And I had not. I hadn't heard about it. And so during the IMF period, 3.5 million Koreans donated their gold up to a total value of $2.1 billion. Something that people in the World Bank and people in the financial world had never seen before. It was a solution that no one could have even thought of. And that money went straight to the IMF. That reduced the amount of time that it took Korea to pay back the IMF by half. Instead of 6 years, it was 3 years. And Korea recovered from the financial crisis much more quickly than many of its neighbors. So I come to this crisis with lots of concern, right? But having tackled these kinds of issues before, I think the most important thing is that we've got to find a way to talk to each other about them. We've got to bring these issues out into the open. We can't brush them under the table. Let me just give you one indicator of why I think we're still brushing these issues under the table. There's a wonderful pastor. I'm forgetting his name.
조상돈.
Yeah. So Pastor Joe works with the surviving family members of people who died by suicide. Right? And what I learned is that the families of people who died by suicide suffer tremendously after one of their family members dies. And that the level of compassion in society toward the survivors of suicide is almost non-existent. And those things have changed tremendously in other parts of the world. That's a basic thing we can start with, right? Talking about it and insisting that we have compassion for the families, the surviving family members of people who died by suicide. Right? But then there's all kinds of other things as well. I mean, I'm not a psychiatrist, but in the process of doing this work, I learned so many really, really cool things about what people have done in various parts of the world to support people suffering from mental illness. Let me just give you a few examples. These are my favorite examples. In Zimbabwe, a bunch of researchers noticed that the grandmothers were really important and sort of key members of the community that held a lot of social cachet. And so they thought, well, what if we set up a bench outside clinics in Zimbabwe? And what if we taught the grandmas a very simple form of cognitive behavioral therapy? And what if we let people either opt in or opt out and either choose to spend time with the grandmas or not? And then they did a randomized control. It wasn't fully randomized, but they did a trial, and they looked at the people who sat with the grandmas and the people who didn't. And everybody talks about this because the results were so amazing. There was a 61% reduction in depression and suicidal ideation in the communities that had a friendship bench. There was a 60% improvement in the quality of life reported by community members who received mental health from the grandmas. And 80% of people who came to the bench showed an improvement in their symptoms of depression and anxiety. So it was expanded to Malawi, and guess what? It's being expanded to New York City. Right? Can we do something like this in Korea? And maybe there's still stigma. Could you do something like this virtually? Could you do this by Zoom? Well, I mean, we learned a lot about virtual psychotherapy during the COVID pandemic, and it's completely doable. There are so many wonderful new treatments for depression and anxiety, even new treatments for serious mental illness. The thing that broke my heart was to see that while Korea had the highest suspected levels of depression, it had the lowest levels of treatment. We can change that. We can change that right now. And my friends who are the leaders in suicide research, they've told me that every single suicide is preventable. Right? One of the things that we're trying to do, there's a wonderful new training program. It's called, in one case, it's called mental health first aid. In another, it's called psychological first aid. And it's like learning cardiopulmonary resuscitation, CPR. But what you're learning is how to recognize people who might be in trouble, how to ask questions of them, and then how to help them find the help that they need. And some of the training programs are as short as half a day or 1 day. Others take longer. But I think every single college student should get trained in psychological first aid. Why wouldn't you do that? I was the president of university. We trained everybody in sexual assault prevention. We trained everybody in alcohol, responsible use of alcohol. We trained everybody in that. Why wouldn't we train everybody with psychological first aid? If you look around at the countries that have had success, Japan used to have twice the suicide rate of Korea, but then they got really aggressive, and it was a social movement that came from the people. It wasn't the prime minister deciding that they were going to take on suicide, and it wasn't even leading legislators. It was a people's movement, and they just insisted that we've got to stop this. We've got to lower the rate. And guess what? The curve, Japan was up here and Korea was down here. Those curves crossed. And now Japan has a much lower, about 40% lower suicide rate than Korea. So it's absolutely doable. But it's something that has to come from the demands of the people, right? Just basic numbers. Korea spends about 1.9% of its health budget on mental health. The average in OECD is 5%. Japan, with about double the population of Korea, spends 15 times more on suicide prevention than Korea does, right? Japan and the UK, but Japan, remarkably, I think this is a remarkable thing that they did. Japan has created a ministry of loneliness, and they have a whole cabinet ministry looking at how to reduce the levels of loneliness in the population. So lots of exciting possibilities out there. There are new treatments, ketamine, psilocybins, MDMA, cognitive behavioral therapy, dialectical behavioral therapy, combinations of these things. Ultimately, medication is not necessarily going to be the answer. I think there's going to have to be some social reform. But it has to come from you folks. It has to come from people, especially the young people. Peter?
So I watched Dr. Kim's documentary, Bending the Arc. It's not available in Korea, but it used to be available on Netflix in the US. So I had the privilege to watch that. And just like Dr. Kim mentioned, I was surprised. I mean, it was the 1990s, and they had recordings of the conferences and their committees. And what they said back then about these people in Africa, about the movement Dr. Kim and Dr. Farmer was going to do, was absolutely so insensitive, and at some point it was about a fundamental question. So, and these people were doctors. Many of them were doctors who were trying to actively find reasons to not help the people who are suffering. And before that, I met Dr. Kim before watching the documentary, and Dr. Kim gave me his experiences about his fight in Peru and Africa to fight these illnesses. And I didn't to be honest, I didn't fully acknowledge like the full analogy between that until I watched the documentary. Because I thought in a way that right now what we're doing in South Korea, we're trying to, because of the budget, the low budget we're spending to help these people, to save lives, was almost, I would say, it parallels what Dr. Kim have been fighting, and that's what's called an institutional stigma, right? So there are three types of stigma. One is public stigma. So what we think about mental illness, people think it's bad, it's something not good. That's public stigma. There's an institutional stigma where a huge institution, a country, a government tries to actively not fund these people who have mental illness and try to help them because of their institutional or structural stigma that they have. So I thought a lot of that really resonated with my experience with how little we fund to save these lives, which as Dr. Kim said, is known to be preventable. So South Korea is the only country that had the highest suicide rate in the OECD countries for more than 10 years. And the reason for that is most countries, all countries except South Korea, would intervene in these circumstances. They would say, it's an emergency, why are our people dying? So they would put lots of money, they would invest in it, and they would prevent suicide. And that's how Japan, Finland, how the suicide rate dropped. But we're not doing it. So that's a fundamental question we have to ask ourselves. Why are we not saving lives when we know it could be done? So yeah, I think it's, and what Dr. Kim and I have been doing this week in South Korea was that we're trying to start a social movement. So we're trying to, and this is not because we're responsible for it, right? The government had to intervene way before when the OECD gave recommendations, but that has not happened. And it's been 25 years since the suicide rate has been #1 among OECD countries. So there's not much change. There has been improvement in terms of budget, and there has been substantial increases, but it's not enough. So what we're trying to do is what Japan did. So what Japan did, to elaborate more, what Dr. Kim said was, the people who lost their loved ones to suicide, so suicide survivors, they got petition that the nation has to save lives, and they have to invest in it. And people who are in crisis or mental health crises have the right to be rescued, right? So they got over 30,000 petitions, and that's how. And back then, the National Assembly had to respond to that, and that's how they started the national movement, and they started a social discussion about this. And before that, hasn't been done in Japan either. And they dropped the suicide rate in 2 decades for about 40%. So I think that's what we're trying to do. We're trying to. And it's also in line of what I've been doing as well. I've been talking, I've been trying to, the argument I was trying to make before meeting Dr. Kim was that suicide was called an extreme choice. And I was, as a resident, I was surprised that we were still using that term, because it's not a choice, it's not an individual's choice, it's a death that a society is responsible for. So that's what I've been trying to do, and that's what I've been trying to shift. And an argument I was trying to make was that these deaths are preventable. These deaths are not an individual's weakness. This is because we are trying to, we are actively not saving these lives. So yeah, so that's what we've been trying to do, and what we're trying to do with not only the scholars, but also with people who suffer themselves from mental illness, people who have lived experience with mental illness, and people who are YouTubers, who are singer-songwriters. We're trying to gather an army of people and eventually make this more of a campaign that everyone could stand behind this, so we can raise our voice.
Are there microphones for people can ask questions in the audience?
I'll just get right to my question.
Yes, thank you.
Yes. So as we're talking about the question of why, I was also curious about the how. Because when we're asking, okay, why are our people dying? And I like to approach through the lens of empathy and, relate to the experiences Koreans are having, including myself. How is this difficult? Instead of, why is it so difficult? Because how talks so much about the real life experience that we're all collectively sharing, which can be one of the answers to the collective suicidal episodes that we're currently talking about. So I'm curious about the how question versus why, and I'm curious about your thoughts. Thank you.
So my view of this is I think pretty straightforward. What we're trying to start is we think that Korean people have to have a conversation about these issues in a very open and direct way. And that conversation is not happening right now. And according to everyone I've talked to, it's not happening, right? Mental illness is still incredibly stigmatized, right? The survivors of people who die by suicide are still incredibly persecuted and shunned, right? So these things are still happening. And I think the job of our team, the team that we have, is to bring you ideas, right? Is to say, here's what Finland did, here's what Sweden did, here's what Japan did. When I go back to the United States, my first 2 phone calls are with 2 leaders of the Japanese suicide prevention team, right? We had to look a long time to find 2 people who spoke English who could speak with me. And finally we found 2, and we're gonna collect all that information and put it on the table so that Koreans can decide which of those things make sense and which of them don't make sense, right? So what I'm trying to tell you today is, my gosh, there's so many interesting examples. I didn't even tell you about, the current head of the Department of Social Medicine at Harvard is an Indian psychiatrist who taught cognitive behavioral therapy to illiterate Indian women in villages, and he randomized villages. And the villages that where he taught the local women cognitive behavioral therapy had much lower depression and anxiety scores after a certain period of time. So there's just so many things. You can democratize this treatment so that it's less stigmatized, that you're going and just talking with a group of people in your neighborhood, and then, what if 10% or 20% of them were actually trained in cognitive behavioral therapy? That's what we know. You can do that. Maybe that makes sense in the Korean context, maybe it doesn't. But that conversation has to start. We've got to start putting these issues on the table. I just think back, every time I walk on the Yonsei campus, I think back to 1986, 87 when I hung out here. And I inhaled so much tear gas, 최루탄 너무 많이 맞았. And what were they saying? 새날이 올 때까지. And so the question is, what is that new day? What is the new day that we're talking about, right? The new day we're talking about is not, the revolution is in compassion. The revolution is in not ostracizing the surviving families of people who die by suicide. The revolution is saying, if you're depressed, talk to somebody. If you're thinking about hurting yourself, talk to somebody. The revolution is in having college students looking at each other differently because they were trained in psychological first aid. And they're asking themselves not, do I want to date this person or do I not? They're asking themselves, they'll ask themselves that too, but they're also asking, could this person be in trouble, right? What if you were able to work that into a large part of society? I guarantee you the suicide rate would go down, right? And so I don't know what Korean people will select, but what we really have to do is get people talking about it, put it on the table. My own experience in the United States, I've talked to a lot of people now about mental health issues. And it doesn't take long if I'll say, well, we're working on mental health. Everybody has a story. Everybody has a relative or everybody has a friend who suffers from mental. There's one study that recently came out between Harvard and Queensland University that says that 50% of all human beings over the course of their lifetime will have some kind of mental health issue. Right? So the one thing I feel is guilty and ashamed that I started working on mental health so late in my life. I didn't pay enough attention, but we can't do that now. And I haven't talked to the Minister of Finance yet about these issues, but I'm going to, because this is a fundamental threat to future economic growth of Korea. And it's probably a bigger threat than the IMF period, right? This is a fundamental threat to short, medium, and long-term economic growth, right? So we need to come at this from many different perspectives. And one thing, if we could give the microphone to Dr. Beck, one thing that I'm very aware of, and a lot of students have walked out, and I don't, my first assumption is this is because we're boring, but another assumption is that, they had to go to class. But I suspect that there may be some students, maybe some adults, maybe others, who has a friend who may be in trouble, who themselves may feel in trouble. And I just want Dr. Beck to tell us, what should people do? What should young people do to take care of each other? What should young people do to take care of their loved ones? What should young people do in the face of, what is, by all accounts, by all the data, a major problem here in Korea? Dr. Beck? 한국말로 얘기했습니다.
I will speak in Korean. So the university students in Korea nowadays, so when they attend lecture for 50 minutes, they need to take 10-minute break. That is their definition of just the curriculum. So that is why I think they stepped out for a quick break. Thank you very much for your wonderful talk. And also, as Dr. Kim talked about, his experience in Yale, the case in Yale. So the process of breaking down the prejudices held by so many people. So I think that is kind of a great example that young people in Korea can replicate here. I really believe that. And now there is a peer specialist. So they can be peer specialists. So if you've gone through the same pain, same suffering, you can help others dealing with a similar pain and suffering. So in that way, we need to make it possible for them to open up about their pain. So that is what I'm trying to do here.
Say something about what people should do.
No, let's get the next question. Yeah.
Question, yes. There's a mic right there, yeah.
Okay, I don't need to shout then. Thank you. My name is Rita Kalambe. I work for United Nations Population Fund here in Seoul and actually in the university is the office. Thank you so much for this extremely interesting panel and discussion and your wisdom. I think that what you're talking today, it's exactly very timely exercise. And the topic, the low fertility, as UNFPA, we work a lot on these issues of population and fertility, reproductive health, and young people. So what I know, I've been here just for 2 months, but what I noticed that young people, they're already burnt out by the time they come from high school. And speaking with them about starting families, having children, having future, they don't see the future, not because of the economic crisis as many other countries, because Korea is not like this. They're actually a booming economy. So they feel like they're already old while they're still young. So what I'm thinking, listening to you, that definitely the reforming of educational system will be needed, that young people the children will learn about life skills, coping constructively with stress. They would learn about it from the very early age. I can't say kindergarten, but definitely elementary school. So that will be important. And another thing that would be interesting as well, if South Korea will, and I'm sure, looking at this nation, I'm admiring that will excel in addressing this issue. So that could be the model for the entire world, because more developed countries are, more mental health issues they experience, especially among younger generations. And of course, Happy people will have happy babies and more of them. And frustrated and depressed will not gonna have families. Thank you.
Thank you. I love UNFPA. You know, Babatunde was a very good friend of mine.
Absolutely. Thank
for
you.
a long time. You guys went through such hell through various political regimes that I won't mention. But please, next time, you know, we should talk, because we're all trying to bring these issues up. You know, I heard a number that for each child that's born, the cost to parents, no matter your income level, to put that person through all the hagwon system is $300,000 per child, right? And so again, you know, it takes a huge income to be able to pay for that. Is there some kind of reform that we can go through there as well? So I think we're out of time. Would anyone like to say? Okay, yeah, let's keep going. If we can keep going, let's keep going. Over there, can we?
Thank you so much. Hello, my name is Betru Shine. I'm a senior student at Yonsei University majoring in sustainable development. And currently I'm writing my senior thesis on the topic of South Korea and its mental issues. So I try to connect, maybe, because we're entering a whole new era with artificial intelligence, if we can maybe tackle mental health issues using artificial intelligence. And I wanted to know your opinion on it. Thank you.
Well,
Go ahead.
yeah, I mean, there are many approaches obviously available. For example, AI, I believe there's a study ongoing that using AI, we could sort the information that could be potentially provoking suicide or trigger suicide. There are AI models that could, I mean, I believe South Korean government is already doing it at local government level. The AIs are checking in households to see if they're, you know, because of kodoksa, of the phenomenon of dying alone. The AI would make a phone call and check if someone responds and someone answers, that they know they're alive and well. I mean, that's not enough, obviously. We'll have to make more contributions to it. But yes, I believe there will be many opportunities with the development of AI. But I mean, I'm a conventional psychiatrist. I'm not an innovator. And to be honest, I don't think AI could replace human connection, right? So the person who first described suicide was Emil Durkheim. He was a sociologist more than 100 years ago. And how he defined it, I think, is still relevant to the current state. And what he said was the cohesion of a society, if there is cohesiveness in a society, the suicide rate drops. If the society is not integrated enough, the suicide rate will rise. And I think a lot of South Korea's suicide rate really has to do with social capital. And because, you know, before the IMF crisis, the suicide rate was much lower than Japan. It was actually half of what it is right now. And after that 1997 crisis, it just doubled. So there has been a fundamental shift that almost depleted the social capital of our nation since then, and we haven't recovered from that. So AI is great. I think there's great promise to it, but I think as Dr. Kim mentioned, the loneliness, we're not going to solve loneliness with AI, right? I mean, lonely people won't feel that they will connected when they get a call from an AI. That's not enough. So I think what we really have to talk about as a society is how do we gain that? I mean, it's such a difficult question, but I think we have to ask that question to ourselves.
So and I know we've got the X sign, so but let me finish with this comment. So a friend of mine, one of my former students, is running a company called Cerebral. It's an online mental health company, and he has implemented AI so that when you join the online company, they're monitoring the emails, the texts that are coming back and forth between the platform and the patients. And there are wonderful AI tools that can detect if someone might be suicidal. So when the alarm goes off inside the company Cerebral, that person gets a phone call within 30 minutes, right? Because there are strings of words and messages and types of communication that are identified with people who are being suicidal. So I think there's a lot of possibilities. Some people even use AI to provide direct therapy. I think that's going to be a while in coming, but it's interesting that we're doing that, right? Now, I just want to leave you with this idea, right? So from my Jewish friends, I learned of the concept of tikkun olam. Tikkun olam, Partners in Health was the idea, although Partners in Health is people from many different religions, the idea that drove what we were doing we called it a preferential option for the poor, focusing on the poorest and what care they're getting. Tikkun olam is interesting. It means heal the world, right? And so I hope that at some point, rather than hearing this as sort of, giving you depressing data, right? Our friend from UNFPA said it. I think it's absolutely right. Korea has led on so many things. When I went to African countries, every single African country said, "You're Korean, right?" I said, "Yes, I'm Korean American." They said, "How did Korea do it? How did they go from being one of the poorest countries in the world to being the only country in the top 20 economic powers that went from being poor to being wealthy? How did they do it? We want some of that." Now, they're saying, how does BTS do it? How does Jungkook do his dancing? They're asking those questions. But what I would love to see is Korea leading the world on this mission of compassion, leading the world on this mission of healing their society, remaking the connections that we used to have in order to emerge from this current, frankly, I have to call it what it is, demographic crisis, and not only healing itself, but providing the vision for all the other countries in the world that will undoubtedly go through the same thing. Thank you for your attention. Please, if you are having trouble yourselves, tell somebody, ask for help, and Dr. Beck or someone in here will do our best to help you. Thank you.
Thank you.
Thank you so very much, Dr. Chim Young Kim and Dr. Peter Jong Na, for sharing your insights. It was truly inspiring to understand the current state of mental crisis in Korea and contemplate solutions for the existing public health crisis. We very appreciate your thoughts and suggestions to improve the current situations here in Korea. Thank you very much. And for your information, classes at Yonsei start at 3 p.m., so that's why I think the students left just before the hour. Okay, so we'll have an approximately 10, 11-minute break now. So please stay with us. We will resume our next session at 15:20 with our next plenary session on care economy for social sustainability. Thank you.